Hello, and welcome to Rappaport Connects, where we interview notable Rappaport alumni and fellows. My name is Sean Horrigan. Today we're joined by Dr. Heidi Rehm. Dr. Rehm is the inaugural Rappaport Research Institute Endowed Chair. This prestigious award permanently funds and provides a reliable and sustainable reservoir of support for the pioneering work of Mass General's leading scientists during the most productive periods of their careers. When the first map of the human genome was completed in 2003, physicians and scientists touted the many ways this powerful new knowledge would change medicine. And 22 years later, it has. Genomics, the study of a person's genes and information they encode, have profoundly changed the ways we diagnose, treat, and understand disease. Dr. Rehm and her team are working to unlock the power of genomics by addressing the barriers and obstacles that prevent or complicate the use of genetics in medicine. Dr. Rehm, thank you for joining us today. And why don't we get started with the basics? What are genomics and genomes?
Well, genomics is the study of our genes and our human genome. So when we look at our genome, we're looking for things that might predict our risk for disease, or maybe if we already have disease, it can help explain why we have it. So we use genomes in a lot of different ways, but it's the building blocks of our cells that tell our body what to do.
And Dr. Rehm, you are MGH's first genomics officer. Tell us what that means and how that guides your work.
Sure. The role of the Chief Genomics Officer is really in helping think about how we integrate genetics and genomics into medicine. And so I work with a lot of the clinics across the hospital to help them think about how to order genetic testing, make sure it's getting covered for patients, how to make the ordering process easier, figure out what labs to order tests from, what tests they should be ordering. Is it a panel test or a whole genome? Things like that. We work to provide genetic counseling services so that families that need to understand the complexities of genetic testing or what their results mean can get access to individuals who are specialized with those sorts of skills and thinking about genetics. So I've really worked with a lot of the physicians across the hospital and the clinics to help make sure that patients have access to genetic testing.
What are the benefits of fully incorporating genetics into medical care?
So we use genetics in a lot of different ways in healthcare. One of the most common ways it's used is if an individual has symptoms of a disease that might have a genetic basis. Things like hereditary cancer that's running in your family, more so than just like somebody has breast cancer, something that's a little either younger age of onset or a lot of people are getting cancer. That could be due to a genetic cause. So understanding whether you have a predisposition variant that might lead you to develop cancer can then guide you to take precautionary approaches. Maybe it's a prophylactic mastectomy, have your breast tissue removed so that you can reduce your risk for breast cancer. We also do genetic testing for cardiac diseases. Some people may have heard of Reggie Lewis or Hank Gathers dying of a cardiac condition. That was a genetic condition called hypertrophic cardiomyopathy. And if we know somebody has that genetic condition, we can monitor their heart, put in devices, take approaches that reduce the risk of sudden cardiac death and help those individuals stay alive. So there's a lot of different ways that we might use genetics to inform people's risk or diagnose an existing condition. It's also used to decide what treatment might be best for a cancer that you already have, what drugs are going to be most responsive to that cancer. Also, the drugs that we take daily, we can predict the best dose or whether you're going to have side effects of certain drugs. So there's lots of different ways that we use genetics in healthcare today, and those ways are expanding every day.
How is MGH currently integrating genetics into its patient care now?
Right. So many clinics, especially specialty clinics that see patients with certain diseases, whether they be cancer, pulmonary, lungs, cardiac, your heart, neurological, maybe it's muscle disease or nervous system, pediatrics, where babies might be born with genetic disorders. These are all clinics where patients are seen with certain conditions, and genetics are very commonly used to figure out what's going on and therefore how to intervene, treat, manage that disease. Also, patients who get cancer not just whether they're at risk, but if they get cancer and they have a tumor, often that tumor tissue is tested to figure out what kind of tumor it is and what drugs might be most responsive in terms of reducing that tumor burden or even eliminating the tumor. And then pharmacogenomics, as I mentioned, when you're going to dose a patient with a certain drug, knowing if they might have a side effect or what the best dose is, that's used today. So all of those things that I was talking about, they're all used today at Mass General. We also have started a process to get primary care clinics starting to use genetics. Traditionally, it's been the specialty clinics where they use it in certain clinical contexts. But what we're trying to do now is for those common indications like cancer risk, a lot of the population is actually at risk for cancer. And we want to get these testing done in a broader population. So our genetic counselors are working with the primary care clinics today at Mass General Hospital to help those primary care clinicians that don't have a lot of background in genetics to offer these services to patients. And that's both for cancer risk assessment. And then the other test that we're really trying to help integrate into primary care is reproductive risk. So if you and your partner choose to have a child and you want to know if there's a chance you're going to have a child with a genetic disorder, we offer carrier screening to those couples. And that can help tell them the chance that they might have a child with a rare genetic disease. So that's a test that we're trying to get done in primary care so that people know their risk before they become pregnant, and it becomes a very time sensitive set of questions.
Can that also show if your child could be born with autism or a learning disability? Does it also unlock those possibilities?
Yes, we're testing for different genetic disorders that do include disorders like autism, intellectual disability, syndromes that can cause multiple different clinical features. Autism is a little more challenging in that it's not a strict single gene disorder. Often there can be multiple genetic variants that are contributing, and it's sometimes hard to tease out exactly which one will or won't lead to autism. So we tend not to do as much predictive testing for autism. That's more something we would do if a child did have a diagnosis of autism. We might look for clues that might identify contributors to it, but it's not as much a strict, what we call monogenic single gene disorder. Whereas a lot of other neurodevelopmental disorders that are more serious symptoms like full intellectual disability, things like that, delayed motor milestones, other things tend to be easier to diagnose a specific genetic cause.
Got it. Fascinating. Dr. Rehm, what would you say is preventing genetics from being fully adopted globally by the medical community?
Right. So a couple things. In the areas where it's very clear that genetics will often help, some of the barriers are insurance coverage, and certain insurers do cover it and others don't. So patients getting access to testing sometimes relates to whether they have insurance coverage. In other areas where a patient may have insurance coverage, the tests may not often yield a clear answer. So there are different disease areas where testing can be very helpful and often likely to identify a cause, and other areas less likely. And we are still trying to figure out the different genetic causes of diseases. And so it can vary how useful that information is. So physicians are going to order testing commonly in areas where it often yields an answer. They may be less likely to spend their time ordering testing in areas where it's less likely to yield an answer. So it varies by condition.
Dr. Rehm, you are the inaugural Rappaport Endowed Chair. How will this funding support your research moving forward? What does it mean to you?
Yeah. In a time right now when there's a risk to funding in our country for science, it allows more security of both my salary and my team's resources to ensure that we can stay employed here at Mass General and continue conducting the research that is so important to help patients. And so this endowed chair means a huge amount to me, and ensuring that I can stay here and continue to conduct the research that is so desperately needed by our patients and our community.
we're so happy to support you in this
Yes.
work and endeavor. What's next on the horizon for you and your team? Anything in particular that you're focused on?
Yes, we're continued to discover new causes of rare disease. We're working to build data sharing systems that allow us to identify variants, not only in the patients that we enroll into our study, but be able to identify data from patients all around the world that are very critical to figuring out what the causes of rare disease are. That's an area that I work in. And so we're setting up a new data sharing network called variant level matching, where if I find a variant in a patient here at Mass General and I don't know what it means for that patient, I can enter that variant into a database and search other data sets around the world to find anyone else with that variant and figure out whether they have a disease that I'm trying to diagnose. And if they match, it builds evidence to say that variant is probably causal for that disease. If I find that variant in a bunch of people that are healthy and have no disease, it's probably not causal. So we're setting up this new data sharing system. It's called federated. So everybody's data stays in the same place in their own country, but we can query and send results back and forth. So it's an exciting platform that we're building, and I hope it'll really make a difference for many patients that are seeking answers for their rare diseases.
I'm so grateful for you joining us today, and I look forward to watching you and your team's progress in the years ahead. And congratulations on your chair.
Thank you very much. It's really a great pleasure to talk with you today and to be the recipient, the first recipient of this chair. Thank you.